for giving us the opportunity of sharing our experience concerning building the capacity for bone marrow transplant program in King Saud University Medical City, King Khalid University Hospital. So I would like to start with building the conceptual framework for bone marrow transplant program. We adopted a project management institute model wherein our core variable not only return of investment, rather than aligning the community needs for such specialized program. And I do believe the best starting point for this, we need to be proud of the national efforts which was exerted to structure such services. And I do believe Dr. Hani Al-Hashmi, Dr. Ahmed Al-Saghir, and many other leaders in the field of bone marrow transplant has published a core articles in 2020 under the title of Establishing Hematopoietic Stem Cell Transplant Program, Overcoming the Cost Challenge. Because it's known that such programs are specialized program and high-cost program, wherein majority of oncology centers are having the core services. However, they might be reluctant to establish such service simply because they are not having the collaborative techniques and services which might hinder them from structuring those services, considering the high demand of those services at the national level. So we have drawn the idea very clear. We were persistent and patient for our goal in order to achieve our outcome. So the roadmap for today's session, I will start with the program background, SWOT analysis, how we build the capacity with reflection on the implementation processes, what our current outcome, what the nurses' challenges that we encountered during the process of implementation, and finally, what's our future direction. As teaching medical institute, the vision of the organization to be one of the foremost academic medical city in the Middle East, which aims to advance the practice of medicine by nurturing future generation of health leaders. If we are going to translate this vision statement to our performance outcomes in the balance scorecard, you will be finding that our priority is learning and creating a future generation. So now it became a necessity for us to establish such service in order to provide comprehensive oncology center at the level of our area, which will give the opportunity for our future leader as a learner in our organization. Being a learning organization didn't attach us from other performance measures, including patient-related variables, customer-related variables. It's a fact that the demand for the oncology service is high, even though that we are having a lot of tertiary hospitals at the level of Riyadh and other major cities, but still the demand is increasing. And one of the core elements that was reflected by Dr. Al-Hashmi and other leaders in their paper, they said that we need to go through 4 phases in establishing and consolidating the bone marrow transplant program across the kingdom. Phase 1 is assessment, whether those oncology centers are having the core services. And the most crucial phase is what? Is the planning. Phase 3, activating the center, and the most challenging one is sustainability of those services. Due to the current situation and the data which was presented from 2012 up to 2016 at the level of the national level, One of the main challenges is the patient accessibility to the specialized services, mainly the bone marrow transplant, as well the oncology service. So the Oncology Center in King Khalid University Hospital being established in 2016. Prior to that date, we were integrated under the medical services. The core services were there, however, it's not well defined. Radiotherapy, chemotherapy, surgery were there. However, the advanced services like nuclear medicine, advanced lab testing wasn't well defined at the level of the organization. And this was the trigger zone for us that in order to enhance our patient experience, patient outcome, achieving the vision of the organization, we need to redefine the scope of service of the Oncology Center to be aligned with WHO model, which caring of the patient and community from the phase of prevention, screening program, up to palliative and hospice care. So the mission were structured by December 2017 to establish well-structured program. And when I said well-structured program, meaning it contains all required services of autologous bone marrow transplant. And we intentionally started with autologous because the requirement for structuring autologous program is less than the allogenic, wherein we do believe when we have done our feasibility study that we need at least 2 to 4 years to structure the allogenic bone marrow transplant program. We cannot deny that COVID pandemic affected significantly our plan for many reasons: availability of resources, accessibility to another organization whom they are considered as our partner in the process, but still, always we were focusing toward our goal. We need to make the center as comprehensive center. At the same time, still, the IOM report, which was released in 1992, was at the back of our mind, which is crossing the quality chasm, providing safe care in timely manner, which, to be honest, one of the key variables that always we will look into when we structure this program. So the key findings of our SWOT analysis, as you can see here, we are talking about educational medical institutes. We are having highly qualified medical team. We are having the physical setting. Availability of a drug, frankly speaking, it was a strength and weaknesses at the same time. We encounter a challenge of availability of certain mobilizing agents at the level of the organization. Resources and funds are there. The core weaknesses that we encounter at that time is the availability of advanced services, including CD34 enumeration. We used to do validation for our reading with other 2 test centers, as well the integration of other support services like angio, like blood bank and apheresis unit. Opportunities, we have many other organizations whom they are willing to support our program. We cannot deny that King Fahd Specialty Hospital in Dammam, National Guard Hospital in Riyadh, they supported us a lot till the moment during the successive implementation of this program. And finally, the threats that we encounter is again the cost and the sustainability of the required resources and meeting the regulatory requirements. Going back to the core skeleton of the program, following the Dunobedian model. Structural-wise, we identified that we need to work on the team competency, nursing, clinicians, structuring the policy and the procedures, and adopting the standards of care, and integration of all support services. At the level of the processes, is assigning a clinical coordinators in order to facilitate the process of caring and defining the treatment roadmaps. And at the level of the outcome, how we are going to structure a proper follow-up program, taking notes that we are having late side effects or adverse effect of bone marrow transplant program and maintaining sustainability plan. So again, this is the main challenge that we encounter. How to make homogeneous structure in order to make sure that we are building successful bone marrow transplant program. So here, and I will go to Dr. Bassem's statement, when we said concerning nursing practice. Yes, you are right, but I would like to reassure you that we are having the right steps. Princess Noura University, the digital university in Riyadh City now, are graduating nurses with master degree as advanced nurse practitioner. And we are having now initial communication with them to define their scope in aligned with their educational competency. As temporary plan, we had a partnership with Oncology Nursing Society to build the competency of our nursing team. As well, we sent our nurses for well-established institute like National Guard, King Fahd Specialty Hospital for fellowship in order to monitor and to learn the culture from their organization. The transplant ward, we work physically to prepare it with HEPA filter as well positive and negative pressure room. Blood bank team were not detached from the plan. They've been sent to another organization whom they are having well-defined program to mentor the process, how it's done there. As well, the ad hoc team and the pharmacy team. The pharmacy team being provided with all roadmaps in order to make sure that all required drugs and chemotherapeutic agent will be available at the time of a transplant. Even we did not omit the scientific reference for the whole team. We have subscription for all our oncology team and task force team for the digital library in order to maintain the accessibility for the required information. And on top of that, we made sure that we are integrated successfully the support team, which they are playing significant role in determining the outcome of the bone marrow transplant program, including social services, nutrition department, and socio-oncology. And here is the implementation plan. In 2017, we started with autologous multiple bone marrow transplant program for multiple myeloma. 2018-19, we expedite the autologous to include the lymphoma patients. And in at that time, from 2020 till 2021, COVID impacted the progress of this program. At the end of 2021 and 2022, we proceeded with allogenic transplant program. And this is summary of the journey till we were able to structure the autologous bone marrow transplant program at the level of multiple myeloma. And here I'm sharing the key outcome of the program from the moment of structuring this initiative. In 2017, we had 10 cases of autologous bone marrow transplant program, and mainly it's for multiple myeloma. In 2018, we were successfully capable to do 12 cases, 2 for lymphoma and 10 for multiple myeloma. In 2019, we have done 10 cases, and in 2021 till 2022, we have done 4 cases of allogenic and 6 cases for autologous. So per disease, we have done 20 cases as multiple myeloma, for lymphoma 6 cases, and for allogenic 4 cases. And I'm coming toward the end of my presentation. Remember that the nursing team are the core team behind the successful implementation of those programs. because they are the one whom they are the frontliner with the staff. They are the one who's doing the facilitation and the coordination of the services. We have encountered many challenges during our journey for implementation. And here I'm talking about the nursing team. And starting by core and evolving knowledge, wherein we overcome it by adopting the international competency framework by Oncology Nursing Society. We trained our educator and resource nurses to structure and inculturate those competency among our frontline nurses. We gave them the opportunity of being cross-trained in another organization whom successfully they implemented this program in order to make them ready and valuable to handle such high-risk population. Even though at the level of the hands-off, we have sent them for specialized training courses outside the country in order to sharpen their competency handling advanced procedure. At the practical level, the roadmaps the staff being given the opportunity for deep exploration of disease-specific roadmap. And if you notice at the very beginning, we are having naive steps before we are expediting those programs. And simply the reason behind that, we want to make sure that we are inculturating and building those programs in a fixed and well-structured basis. Patient education, considering the nurses' demographics at the level of our organization and the need of bilingual nurses. Structuring and building the roadmap and the assessment sheet on the electronic system. Structuring a proper follow-up program post-transplant when the patient are going to be discharged. Nursing familiarity and competency, how to handle patient with GVHD. Moreover, which I do believe majority of the organization currently are encountering, which is the high turnover of the nurses team. Meaning, and this alerting us that still we need to build the competency for the new arrival at the level of the organization, as well the last challenge, which is the availability of the supplies and the resources. So where we are heading, inculturating autologous allogeneic bone marrow transplant program, expediting the scope of practice for the oncology center, as well successful integration of independent allogenic bone marrow transplant program. Thank you very much.